I've washed my hands, and I'm going to introduce myself to the patient, who is David, and I'm going to do your head-to-toe assessment today. Is that okay with you?
Yes.
Okay, thank you. First thing I'm going to do is check your scalp and your head. Everything appears symmetrical, and your hair is not receding. You're not losing any hair. It's fine, but you do have a full head of hair. Okay. Your skin on both your arms does not appear to have any moles or scars. Same thing with your fingers. No moles or scars on your hands or fingers. No, your hands are symmetrical, and you have good circulation with good capillary refill on the left and good capillary refill on the right. Okay. So what I'm going to do is I'm going to move forward and take a look at your eye and see how it looks. So I'm going to put a bright light in your eye. Okay.
Mm-hmm.
So if you could just bear with me, that'd be great.
Turn it off.
There it is. I don't know what I did wrong.
There. Oop,
All right.
it must not be on.
And the otoscope does not want to work. Why? I don't know. Okay. All right, open your eye nice and wide so I can take a peek in. Okay. Vasculature looks normal. No AV nicking. And I don't see any ictuses in the eye. We're gonna look at your right eye now. I know. The right eye has good vasculature, no AV nicking, and no ictuses seen. His conjunctiva are nice and pink, and his sclera are white. Okay, I'm going to take a look inside your nose. Actually, what I'll do is... And what I'm going to be checking for is to see if you have any pustules inside there or polyps or anything unusual. Okay. So there are no polyps inside the nose. And now I'm going to clean it off, and I'm going to check your ears. In the right ear, the left ear, the eardrum is pearly white. No fluid behind the eardrum, and there is some wax. That way, just like that. In the right ear, the eardrum is pearly white. And there is a fair amount of dark yellow wax. Okay. All right. So close your eyes. And what I'm going to do right now is I'm going to check your your nose nerves. Do you smell anything? Okay, so that was to check olfactory nerve, which is cranial nerve number 1, which he passed. I want you to close your eyes really, really, really tight. As tight as you can. And then open them way, way up. Very good. And I want you to grit your teeth, clench them really hard. Okay, and the structure of the face feels nice and even. No spurs on the bones or abnormalities. Smile. Okay, smile is symmetrical. Puff out your cheeks. Very good. So now I'm going to test to see if you can feel me touching you. Okay, close your eyes. Where am I touching you?
Left cheek.
And is it soft or sharp?
Soft.
Where am I touching you now?
Right cheek.
And is it soft or sharp?
Soft.
Okay, very good. Okay. Alright, so let's see how your arms move. Has good range of motion. So don't let me pull your arm down. Very good. Same on this. Check your range of motion. Okay, don't let me pull your arm down. Okay. I'm going to try and push your shoulders down with my hands. Don't let me do that. Don't let me push your shoulders down. David.
I'm not.
Oh, you're supposed to push up. Okay. So I'm going to do the same thing. I'm going to push your side of your face with my hand. Don't let me push your face the other way. Okay? So he has symmetrical strength in his trapezoid muscles and his face. Okay, so next what we're going to do is I'm going to check your ears for hearing. I'm going to start with the Weber test. Do you hear that?
Yes.
Okay. Now what I'm going to do is I'm going to place it behind your ear. And when you stop hearing it, I want you to let me know, and I'll place it directly where your ear opens up so we can see if you hear that way, okay? Do you hear it? Okay.
Yep. Still hear it.
Okay.
Yeah, that's fine.
Okay. Do the same on this side.
Okay. Yeah, it's done.
Very good. So, David heard it the same amount of time, which I've never had happen, on behind the ear and 2 centimeters where the auditory canal is on both sides. Now I'm going to take a look in your mouth. You can just open up and say ah. So the soft palate and the hard palate look good. His mouth looks nice and pink and moist. His teeth are white. And his uvula is right in the middle. His tongue is not furrowed. If you could lift your tongue up, please. And there are no plaques under his tongue. So if you could stick your tongue out for me. Move it side to side. Okay, very good. So I'm going to feel your lymph nodes. All right, I'm going to start with this submantle right here. And the submandibular. And the preocular. And your ocular in the back. Very good. Okay. Okay. So what I'm going to have you do next is I'm going to have you lay on the table so I can check to see if you have any jugular vein distension. David does not have any jugular vein distension on his right side, and he does not have any on his left side. Okay. I'm going to listen to see if he has any carotid bruits at all. And David does not have any carotid bruits at all on either side. I'm going to listen to your heart, so just breathe normally. Heart sounds are regular. S1 is heard loudest in the apex, and S2 is heard loudest in the base. Okay. So what I'm going to do is I'm going to assess your abdomen. And first I'm going to percuss your abdomen. Okay. And then I'm going to palpate your abdomen. Spleen and liver are where they're supposed to be. They are not enlarged and they are normal size. I'm going to take a listen to your bowel sounds now. David has positive bowel sounds in all 4 quadrants. Okay, so I'm just going to check your range of motion in your legs. David has good range of motion in both of his legs. David has a 5 by 5 centimeter birthmark that is brown in color on his left leg, proximal to the knee. David has positive popliteal pulses and bilateral positive pedal pulses. Okay, you can sit up. So if you could stand right over there, I'm just going to move the table a little bit out of the way because we're going to do a Romberg test. Okay, so if you could just stand straight with your feet close together and just look at me with your eyes open. Okay, now you can close your eyes and stand there and stay as straight as you can without leaning forward, leaning backwards or to the side. Good. Okay. So now what I'd like you to do is I would like for you to walk to me, heel to toe. Okay, you can turn around and walk on your tippy toes back. And then you can have a seat up on the table one more time. So now we're just going to check your coordination. What I'm going to have you do is touch your nose and then touch my finger several times. So if you could do that, touch your nose and then touch my finger. Touch your nose, touch my finger. Okay, do that a couple more times. Great. Okay. The other thing I'm going to have you do is I want you to touch your fingers like this a couple times. Very good. Now I want you to just look straight ahead at me, and I'm going to have you follow my finger with just your eyes. Mm-hmm. Okay? Very good. Now I want you to take your hands and flap them up and down really fast on your thighs. Okay, very good. And that concludes our examination for today. Thank you for participating.
How do they do?
Good, is it soft?